the social vulnerability assessment in disaster risk reduction. And also, I think because he is he has experience on Aceh and in Aceh, then I think would like to present more insightful perspective for disaster risk reduction. That's please, Dr. Bayas is
Okay.
to start.
Can you hear me,
Yeah,
everyone?
yeah. I can. We can. I
And
think it's
can you
quite
see
clear.
my
Yeah,
slides?
yeah.
Okay, so
Also, we can
let me
see
start
that
my
clearly.
presentation. Thank you, Adi, and thank you everyone for inviting me. And I hope you can hear me properly and see my slides. So, yes, I'm Dr. Bayas Ahmed, currently working as a lecturer in the Institute for Risk and Disaster Reduction at University College London. And today I will talk about social vulnerability assessment because I feel it is very important to understand society and how disasters interact with our society and in different cultural contexts. So I hope my presentation today will be helpful for different professionals and people working in different organizations as well. So we work in different contexts like natural disasters, conflict and war, already mentioned. We are facing pandemics, climate change, and many other humanitarian crises. And where it is very important to understand how a society, because we have so many different countries already been presented by our previous speakers today, from Haiti towards Indonesia and in many other countries in Southeast Asia and South Asia, in other least developed countries. So our society is different, culture is different, and we really need to understand probably the same hazard or disasters might have different impact on different societies and countries. And I will highlight today one of your thematic area for today's conference on social science advances to deal with natural disasters. So quickly we should, this is the very simplistic equation of risk, which is a product of hazard, exposure, and vulnerability, where hazard and exposure are physical dimensions, and vulnerability, where today I will highlight on, is the human dimension of risk. And to understand vulnerability for any community, any society, or any country, because that involves human participants, it might have different dimensions like social, economic, ecological, institutional, political, and cultural. So when we say, I want to conduct social vulnerability assessment, you must have to cover all these different dimensions. So this is one flood inundation map. I have taken a case study from a country in Bangladesh, a South Asian country. Uh, and we can produce physical hazard map or multi-hazard map utilizing different techniques like GIS and remote sensing, probability, empirical modeling, and many other methods we can incorporate. And that's been very popular for tsunami hazard mapping, earthquake hazard mapping. This is in the right, river erosion and flood hazard mapping of Bangladesh, with using different methods and legends. But here I give you another example. So you see, these are all shelters, actually river erosion shelter. This is again from the northern Bangladesh. But the shelters are now being eroded because of extensive river erosion and flooding. So you can see, even having a hazard map, knowing the exact location of river erosion, we can map it, but in reality it might be different. Even your shelters might be impacted. So I give you another example. This is a brand new cyclone shelter in the southern coast of Bangladesh that was built just in June this year and very expensive, but now you can see it is inundated under flood water. But next, I will show what happens in the developing countries and in many other contexts. Um, Here you see, because of extensive flooding and river erosion, this is a primary school, again from Bangladesh, and is completely destroyed and very common. And this is the cyclone shelter from the previous slide. And after a few days, this is from the July flooding in Bangladesh that inundated one-fourth of the country. The entire cyclone shelter is now completely gone. So cyclone shelter or any kind of shelter, it was, constructed after analyzing many things, the hazard mapping, and it was meant to save the people. But the shelters are not safe anymore. What is the problem? The local people are blaming because the authority didn't come and discuss with them, and in that way they could prevent this kind of disasters and prevent the wastage of public money. So it is very important you talk to the local people before you take any intervention or any hazard mitigation steps, and learn from the local communities, from their experience, and how disasters can impact them. So yes, how can we do it? How can we go and talk to the local people? Yes, when we prepare hazard maps, like the physical multi-hazard maps, we do it mostly using GIS, remote sensing, many other techniques without much interaction with the local community. Even if you have a laptop and programming skills, you can develop maps or flood inundation maps from your office room. But it is, I always highlight how we go and talk to the local communities. We apply social science methods, namely quantitative and qualitative. One very popular method is you produce a questionnaire survey and you go and talk to the local communities based on sampling, like you can have different questions, and this is one we are conducting, visiting a local village, talking to them and conducting questionnaire survey, and based on several thousands of sample surveying, you can, this is another questionnaire survey, photographs from the local community, you can come back and analyze their social vulnerability using statistics. Like here, you can also produce graphs that is very common, probably many of you know. Yeah, we combine three different types of variables and you can run regressions. So this is one method to reach the community through structural questionnaires and understand uh, the problems they're facing and their socioeconomic conditions. But the quantitative social science methods, it has some limitations, like the question is developed by you again, and it sometimes fails to, you know, distinguish between the local people and the natural world, and it brings the static view of the society. However, we have qualitative methods. That's some methods include one-to-one in-depth interview, micro-narratives, focus group discussions. So you can conduct FGD, already mentioned by the previous speakers, participatory rural appraisal, and other case study work. So today I will highlight the number 4, participatory rural appraisal, how we can apply it and understand social vulnerability. So this is one photo. Again, I'm conducting a focus group discussion with some members of a village. And here what we do, you just spend an hour or two and the different questions you have and queries to understand the problems they're facing and different mitigation strategies they're taking. So what is PRA? It is participatory rural appraisal, a very popular method we apply in different contexts where you bring the local people, talk to them, and they share their ideas with you. It was it is also known as participatory rapid appraisal. The method started was introduced first in back in 1980s. So I will explain a case study how we applied PRA methods. So we went to Tuttuk village in Ladakh in India back in 2017. It was a 2-day workshop in a local primary school. You can see uh, the village was really located in high altitude, above 3,000 meter the sea level. It was in Jammu and Kashmir, highly conflict affected areas. And so here in the map, you can see the location in the red dot on the top left corner. So the location is in a very strategic location. It is in between India and Pakistan, near the line of control that divides the disputed Kashmir area. So what we did, the village is surrounded by high mountains, very extreme and harsh weather, and also surrounded by rivers. And here, for example, the photos were taken by me. Here there was an army camp that was destroyed and killed 18 Indian soldiers because of flash flooding. And also war is very common in the disputed Kashmir area between India, Pakistan and China. Now you all know India and China is having real difficult time in this area in Ladakh. So Kargil war was also brought major impact for this village. So here, war, conflict, and flooding, landslides are very common. So what we did, we wanted to understand how the local people, try to adjust with all these different hazards and disasters. So what we did, we took ethical approval from the local communities and local universities, and this is our team. Of course, I was there and taking the photo, and it was a team of 10 members. What we did, we invited around 40 local people comprising school teachers, health officials, very general local people like the taxi drivers and other participants from the Turtuk village. And we divided them into 4 different groups: to men only, women only, political leaders, and administrative officials. So, what we wanted to know, so we divided them into different groups and we assigned some, mm, we call it tools, and wanted to understand what's the different perception of men, women, and politicians and other people. So we applied 3 different participatory tools in 2 days. The first one is known as timeline. Through that, we asked them, can you just highlight some major environmental and conflict related disasters or events? So know about the past, like they mentioned the major conflict or war they faced or major natural disaster they faced. And then the hazard mapping, we call it participatory hazard mapping, where we requested them to draw your community, identify different important critical infrastructure and facilities, and identify different hazards and low, medium, and high risk areas. So a community map, community hazard map prepared by them. Lastly, a dream mapping exercise. We told them to draw a map they identified so many problems within their community already through the timeline and hazard mapping. And in the dream mapping, we told them, can you redraw the map like to address all these problems and incorporate all your recommendations to get rid of different hazards? So I will show a video and then we provided them the stationaries and the different guidelines on how to produce the maps. And this is how the local people, you see, They are discussing, this is one group, we call it men's group only, and they are producing the participatory maps. So they are drawing the hazard map with discussions. So they are drawing their community. This is the politicians, local politicians are drawing the map. So this is one way to involve the local people, and they draw the map, they identify different problems and hazards, and they also recommend how to mitigate those hazards. So very useful technique. So this is the entire four groups, and this is outside the primary school. You can see landslides are very common and also flooding. So next, after each activity, and each group presented their map. You see, this is another group, the map properly drawn by them, 100%. And this is another group presenting the map. So this is the map. Later we scanned it. In the left, you can see, originally drawn by them. This is their village. And for publication purpose, we just digitized it. It's the same map. We just put some color, and this is more visible. And they identified low risk, high risk, and medium risk areas, and identified different problems and hazards and their consequences. What we also did, our physical science team conducted extensive geological survey, and this map is produced by our side. You know, this is the multi-hazard map for the same area, but produced by us. And next we have their map. This is their map. It helps you to compare your hazard map and the local people's produced hazard map, and compare where are the similarities and dissimilarities, and it would help you to take a better decision. Yes, different hazard maps you can see, and dream maps. They propose different interventions to mitigate the hazard risk. So they already identified different problems, some to highlight here, like they believe they live in highly hazard prone areas. They have problems with critical facilities and equipment. This is a remote village. They have problems with electricity, Wi-Fi, and many other problems. Also, earthquakes are common. And this is dream mapping. One group, they say this is how they want to see their village. They have proposed lots of interventions, more greenery, embankments, and maybe I'm not going to explain everything now, but yes, they also mention what could be done. So we took detailed notes during their presentation and recorded everything. And from this kind of participatory activity, yeah, later we published a paper, of course. You can identify the problems from the local people's point of view and the mitigation measures proposed by them. But we didn't stop there with publications and writing reports. After 2 years, in July 2019, we again went back to the community to send them some feedback, like what we did from our workshop, what are the different findings, and then we again explained them, and again through discussions we developed a community action agenda. Like here, after 2 years, your findings, we analyzed, and again, through the feedback, some key bullet points were identified. Like they said, they want to create a community DRR group, they want to develop a disaster risk awareness program. Many other recommendations were finally um, uh, undertaken. So we call it a community consultation model. What we do, it has 5 steps. Number one, you conduct the participatory workshop with the local people. Then you develop the multi-hazard map and compare with their map. You analyze the findings. It can be publications, producing reports and policy brief. And step four, again, you go back to the community to take some feedback and compare each other's results and produce a community action agenda. You can be translated in the local language. And the lastly is community advocacy. That is what we did with all the recommendation in step 5 when we went to the local district administration where they were producing local risk sensitive land use planning, and we brought our recommendations, our findings, and it was incorporated in the new local disaster management plan. So this is one model, very interesting. We call it community consultation model developed by us here. We applied in different contexts in different developing countries where how to involve, it shows you how to involve the local people in decision making. So we didn't stop here. This is another photographs in back in 2019. Last year, yes, I was a speaker for another conference, but we also conducted similar workshop in Banda Aceh in Indonesia. We wanted to understand uh, how the local people recovered from the Great Indian Ocean tsunami. So these similar activities we performed with them. The work is still ongoing with different activities with the local people in Banda Aceh. You see they are drawing the maps and diagrams, and later they presented their maps and ideas like what happened during the tsunami and after a decade or more, how they are adapting with extreme scenarios. So yes, this is from women's group and this is from men's group. It also interesting how different groups think in a different way. And lastly, last few slides, and how we can. So this is hazard context, of course, but I will give some example from the Rohingya camps, how you work in with children, because children are more vulnerable. Until now, I talked about adult people, but how you deal with children and try to understand. It is also important to understand young people's perception of hazard and risk. What we did after taking exclusive ethical approval, we conducted a children's drawing activity. You know, people, we told the children to draw their community or draw their surroundings and identify different problems and facilities they're getting. So with children, we found the drawing activity was very useful. So yes, participatory methods can be different types. There are dozens of tools, space related, time related, and relation related. I'm not going to explain all of them here, just to give you an overview. And quickly remember, today I mentioned social science, quantitative and qualitative. You should know in which context you want to apply quantitative or qualitative or mixed method, and here are the differences between these two methods. Quantitative, yes, is about numbers, but qualitative is more about words or maps. In one case, your idea, like the researcher's idea, get priority, but in qualitative, like the PRA, uh, the participant's idea get priority. Through qualitative, you can develop a new theory that is more dynamic, whereas quantitative is static. Like you have a one questionnaire, you ask and answer, but PRA methods is more participatory, spontaneously people participate, and it's not structured. You get deep data, and the scale can be, yes, micro, but it is in natural settings. So both methods, none is perfect, but some has limitations and some has advantages. So in conclusion, I want to uh, echo, Yes, it is very important to have multi-hazard maps and early warning systems in place. That is the first prerequisite. But please do not forget to conduct detailed community vulnerability assessment, which is also very important because without the society and the community and cultural context, we might not get the overall scenario of disaster risk reduction. And also remember, no method is perfect or flawless, but it all depends how you apply which method in which context. It also depends on your funding availability, time and skills and resources. And remember, these methods are very expensive. Going to a community, spending several days, and yeah, conducting this kind of workshops. So I would always say yes. Also remember about the local communities and society and the method that really matters, how you apply a particular method in a particular context. Yes, here are some references, and thank you so much for listening to me. That's it from me today. Thank
Thank
you.
you, Bayas. Thank you very much for this very interesting talk and also the interesting ideas and experiences. I think you have presented a lot of experience, especially in the community level, that your approach about the how apply participatory research analysis and action, research action, and that we can get some ideas from your presentation. That at least 2 points that I can get from your presentation, that the how important hazard map and also early warning system for disaster risk reduction, and also the second one is the community's approach for the disaster reduction, risk reduction. That's thank you again, Bayas. And we will move to the question and answer. And yeah, we have some questions that we will show in the screen. And the first question would be, uh, do you have any, this is to Dr. Danan, do you have any suggestion that what kind of activities that our community really need at the moment, particularly to support them in the pre-disaster stage? For example, in mitigation knowledge, better evacuation plans, and etc. And any support from us as academics, I think that as lecturer or students. That I think this is first question, and the second question. There are two questions for Prof. Hari. What is the role of community power in dealing with the disaster in Malaysia, and is there any community disaster reduction activists as formed by the awareness of the community? And the second one, the how is the implementation of SDGs in disaster risk reduction in Malaysia? That's all I think. Please, Dr. Danang first or Prof. Heri?
Yeah, okay. So, could you please display the question? Okay, thank you very much for the question. Um, your first question, actually, I also answered in the chat box, but I would like to answer in oral way. The question is how we can help the community, right? In terms of the pre-disaster period. Actually, we need to know the need of the community. Without any assessment of the need of the community, and they would be misleading for us to help them. We should understand actually the character of our community, one area to another, one culture to another, one cultural background, one educational background to another, and different kind of type of disaster, whether they are living in the rural, living in urban areas are different. They are living in mountainous area or in a coastal area. It depends actually on the need. So the first actually what we have to do, like we are doing in university when we are doing and the community services, first problem identification, resource identification, and the need assessment. This is the first period that we have to do so. And the second, after having the map of the problem, the map of the resources, and also we assess everything, and then we can decide what is the need of the local society, what is the priority that we have to do dealing with the local society. Actually, this is what we have to do. So we cannot know directly because the diversity of one place cannot be applied for another place. It's very unique. Yeah, it's very unique. Yeah, this is my opinion. Thank you.
Thank you, Dr. Danang. And for the second question, for Professor Hairi, please. Can we show the question, please?
Wait, can you show the question?
Yeah. Okay. Yeah.
Wait.
And can we show our question first before you show your screen, please?
The first one.
Yeah.
My feedback for my response for the first one, I think what is the role of community power in dealing with the disaster in Malaysia? Is there a community of disaster reduction activities from the awareness of the community? My response is yes. What we doing in Malaysia, we will pull all our leaders in the zone of the flood area. We will pull of them. We will be having a workshop of disaster reduction, giving to the leaders of community first level. Also, we have disaster reduction activists from the NGOs. Also, we're having the workshop, having the theory, including simulation, and including the legal part. And the third level, we're giving to the public community. What I mean, the public community is the whole community staggered by staggered, district by district, and villages by villages. What now we're doing after our big experience. And the second one, how is the implementation of SDGs disaster risk reduction in Malaysia? Now we have, as I highlight before this, we have 3 tier from the district until the central part. However, on the district, we still having the stages from district to the what we call a small sub-district, and until a level from the small village and sub-village. That's why all our SDGs approach for disaster reduction, we will educate stages by stages until the sub-villages. The second one, the rule of our youth, we will conduct the simulation, including the theory and the regulation about disaster, especially for flood mitigation, to our youth leader, including we have volunteer leader. We will educate them about flood disaster. What we done, for our community from the leader level until the youth level, including our community in our ground level. At the same time, during all the initiative, we will collaborate with our government. Also, we will collaborate with some big NGOs in Malaysia. These are our comment for the questions.
Thank you, Prof.
Thank
Hari.
you. Thank you.
That we get some points that how you will, I think you think of the incorporation with the government. I think it's quite similar what we have heard from the Dr. Danang before about the pentahelix. I think that will be also the method or the approach. I think will be quite. I mean, it's quite similar, but also the different in terms of context that we will apply for. I think I think I will invite for the participant that raise their hands, please. If you want to show, I mean, if you want to ask a question, just please. Hello. Okay. And yeah, we have another question for Dr. Bias, and we will see what the next question. Yeah, the question is about the how you apply for your approach in, especially in Aceh, because you have experience in Aceh, and about the PRA or some the another approach, whether this is a quantitative, qualitative, and mixed method that you have experience in Aceh. Please, Dr. Bayas.
Thank you. I mean, yes, I just highlighted one aspect of DRR, that is how you apply the social vulnerability assessment methods, but it also includes, I mean, we have 3 different groups. So like I led the social science. There was another physical science. They did lots of modeling and hazard mapping for the Banda Aceh area. And another, we had a group of civil engineers. So they did some resilience building type of activities. So as part of my work, I wanted to understand the local people's perception of tsunami. I mean, these are new communities, of course. The old ones who used to live there, they left that area, but these are new people. What I found, we went to some local communities physically to see what is happening. They have now new shelters, tsunami shelters, some early warning systems in place, and some other awareness activities ongoing. And through this different 2 days activity, it also helped us to, identify some of the lackings they're still having, because they really live very close to the sea. I mean, the ocean. I can see it like just 100 meter from the local village. So they're still highly vulnerable to tsunamis if there is another one, but probably they have a strong early warning system. They might get warning beforehand, they can evacuate. They have evacuation and shelters, evacuation plans ready, and strong shelters so that they can quickly climb in the 2nd or 3rd floor of the shelters, and they look really strong. So some mitigation steps are there, but you have to remember you cannot stop there are thousands of people, isn't it? You can stop their livelihood. Probably they depend on fishing and other agricultural activities near the coast. So this is a balance between how you maintain their livelihood activities and also gives them some protection from natural hazards like tsunami and earthquake. So yes, we are still analyzing the data extensively and trying to formulate some policy guideline for them. So we are working closely with TDM-RC and Shiakwala University probably. So that's it. Thank you.
Yeah, thank you, Bayas. And this is still one question left, and then yeah. This is not responding actually. Sorry, that's is sometimes yeah. There is one question actually. I think.
Is it for me?
Yeah,
Is
yeah. For you guys.
I can read it from the panel. Okay, so someone asked me.
Yeah.
It was very interesting project you have presented. One question for you. Okay. Did you find any hurdles in doing or obstacles your research? Apologies, I forgot the name. Yeah, participatory rural appraisal hazard mapping, and you have presented. So we know what is the biggest difficulty you have. Okay, so yes, so someone, thank you, Nurizani, for asking the question. There are lots of difficulties to, first, you cannot directly go to a community, isn't it? Because I am not from that area. I am from another country. The one example I showed you from Ladakh in India and the other one from Banda Aceh in Indonesia. So we had a team of 10 members. You will see it was a mix of international scientists and local scientists. So we always collaborate with local universities. So for Indonesia, it was Shiakwala University and TDMRC. And for Jammu, Ladakh, it was the University of Jammu. And you need a strong collaboration first so that they will help you to get local, and you need local ethical approval. And these are the steps. So without that, and you also need risk assessment and other protections before you go to, and translators, of course. We always had translators because, of course, I don't speak local language in Banda Aceh, and also in India, they speak not Hindi or something. So yes, you need partners, translators, approvals, permissions, of course, visa. We need special type of visa to conduct this kind of work. So it's a long preparation when you go to a community first. And then it comes with you should have proper setup, because if you have a setup with, who will be interacting with the local participants, then it would be easier for you to make sure the hazard mapping or participatory mapping activities take place in a good shape. And we provided tables, chairs, necessary papers, color pencils, and all the stationaries were there. So that was not a problem, frankly speaking. And we provided breakfast, lunch, and also afternoon tea. So all the arrangements were there. We also paid for their local transport, and there was daily allowance for the local participants. So it's a huge arrangement. It took us several months to organize only the 2 days of workshop, working closely with our UCL partners, local universities, even community leaders, and different types of permissions. If you have all these arrangements there, so the local participants feel safe and they know what you are doing and who you are, probably they will come and participate in a group. And if you give them some activity, they will feel comfortable to participate. So this is how we made sure our activities, the peer activities, we call it participatory role appraisal mapping, it it works. And yes, we have written some articles. You will find it my reference list, and more are upcoming. But we found it really helpful to get and collect information from the communities at risk. Thank you.
Yeah, thank you, Bayas, for comprehensive explanation that your even recent experience on that issue, and especially in Indonesia. And I think that's all question that we have. But before we finish, we would like to first. I would like to show some at least 3 points that we can get from this session. The first one is about how important the investment, because the disaster risk reduction is about disaster risk management is important to be invested by the government. And also the second one is about the collaboration between academia and policymakers, and also the community and even industry, that we can go together with the to tackle this issue. And the third one is the contextual. It's really depends on where we work, and then we can have insight about the more contextual approach of these things to tackle the disaster. And before we finish this, I think I would like to invite Dr. Danang, I think, to also Prof. Hairi and also Dr. Bayas to have a concluding remark, please. Dr. Danang first, or Prof. Hairi, or Dr. Bayas?
Okay, thank you very much. So thanks for giving this very interesting discussion with regard to disaster risk management. It's really insightful for me, for all the speakers and all the questions from audience. And first, I would like to emphasize on the pre-disaster investment, ranging from mitigation, risk prevention, and also capacity development. It is very important for us to invest on this particular subject. And now we are providing some inputs to the government to the revision of the law of 2007. And it's time to us to provide a lot of input on that. Yeah, thank you very much.
Thank you, Dr. Danang. Thank you for your talk and your ideas, and then hope we can have very useful for our government and also our society to tackle the problem in Indonesia. Okay, please, Prof. Hairi, if you want to give a concluding remark. Yeah.
Okay. From me to everyone, thank you from Dr. Danang. I think you share something very important. I agree with you, because we need to contribute to our country toward regulation, toward our law regulation, also our planning for risk reduction. However, we also, as an academician, I think, like me, Dr. Danang, Dr. Bayas, and everyone, we need to also participant with our community to become volunteer, to what I mean, to giving the supporting, to giving the motivation to all our community, and to educate them, and then believe us when we join them to having the any program about risk reduction, a DDR program with our community. For me, I also, as one of committee about we call flood volunteer team in UPSI, we will help our surrounding in our university to have uh, some program about DDR, also some program about community volunteer to mitigate our disaster or any our environmental problem. That's mean for me, for closing for today, we need to uh, having collaborate with our community, including our government, also our our country planning. Finally, I would like to thank the committee of the International Conference on Hazard Mitigation in Geography and Education Perspectives for 2020 this year. Maybe we can collaborate and share our ideas, our our SDGs vision to ensure our community having motivation, having knowledge about DDR to ensure we can reduce our uh, hazard and we can uh, giving them something important to save our country. Thank you. Back to our chairman. Thank you. Thank you.
Thank you, Prof. Hairi. That's a very thank you for important points, and yeah, then hope we can collaborate further and working together with our communities. Okay, and the last, Dr. Bias, please.
Yes, thank you for inviting me, and thanks to all the participants and partners from Indonesia. It was really great to see you all again and giving a talk here. So what I would say, please bear in mind disasters, whatever natural hazards, man-made hazards, or technological hazards, including pandemics that what we are facing are very difficult. I mean, there is no straightforward answer or solution to anything. Like the COVID-19 pandemic, you can see I'm staying here in London. We are under lockdown and it's been more than 6 months. I cannot go to my university campus. It's all teaching and everything is online. Same probably in your country or even in your place. So you have to understand disasters are very difficult and it might have multi-dimensional uh, impact on societies and countries. One hazard like the COVID-19, the coronavirus, this is a hazard, but the entire world is now suffering. There might be localized hazards like tsunami, the Indian Ocean tsunami, it impacted several countries and also Indonesia. There might be localized earthquake. I was reading a news today and in USA there is wildfire is ongoing and it displaced almost 500,000 people. That's ongoing in California state. So you can see worldwide we have different hazards, different problems and disasters. And sometimes people come to us or to policymakers, they say, can you get rid or can we get rid of it within few days or within few months? Like I worked extensively with the landslide community and they said, can you prepare a map or early warning system that will be, that will resolve all the problems within a year? uh, Thousands, you understand, thousands of medical scientists and public health specialists are working to develop a vaccine for coronavirus, from Oxford University to probably any local hospital and public health department, but no one is being able to do it now. So it is, you remember, this is a continuous process. We learn from the hazards, from the impact. We try to apply physical multi-hazard mapping, social science and social vulnerability assessment, community resilience and preparedness. So many activities are ongoing, but we have to be a little bit patient about, because these problems cannot be solved within a day, year, or probably within decades. But I believe with all these methods we discussed and issues we discussed here today, like early preparedness might save more lives or reduce more impact. So over time, we might be able to get rid of all the problems, and I believe there will be more disaster. We always call it disaster risk reduction. We can only reduce it, we cannot eradicate it. So like, we don't say disaster risk eradication, like is gone forever. Tsunami is gone forever. The impact of tsunami or flooding is gone. It's not possible, but we can reduce the negative impacts and we can be more resilient. So having more patience and applying more new tools and techniques and methods might be really helpful for the upcoming decades. Thank you.
Thank you, Bias. Very nice points. And thank you very much indeed for your great presentation all. And I think we would like to say that we are very grateful on behalf of committee of the International Conference on Hazard Mitigation, and from a geographic and education perspective. And we would like to say thank you to the all participants also, that we will have a presentation for tomorrow, the parallel session. Thank you very much indeed. Again, I would like to pass on this to the MC. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, everyone. See you, Dr. Danang and Bayes.
See you, Dr. Bayes.
Thank you.
Thank you.
Nice meeting you. Oh,
nice meet you.
Please email me, for any questions and queries or collaboration.
Yeah.
Thank you.
Also me. Okay.
Yes.
Meet
please.
you again, Dr. Danang, maybe for future when I coming to Yogyakarta.
Yes, thank you.
Dr. Bayes, maybe the next conference in our university, maybe we invite you. See you.
Welcome to London as well when there is no pandemic.
Yeah.
Thank you.
Terima kasih, Pak.
Terima kasih.
Matur nuwun. Terima
Thank
kasih.
you, everyone.
Ladies and gentlemen, this is the end of the plenary session. Please be well informed that the parallel session will be held tomorrow at 9 a.m. via Zoom. Finally, we would like to thank all speakers for the experience, knowledge, and insight. Also, we would like to thank all presenters and participants for the attention and participation. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.